Anatomy, zonal anatomy, and intervention of the knee joint. For this topic, there is a few good reference. One is this review article that summarizes those relevant zonal anatomy and procedures on the knee joint. And also there are free books, and this is the iBooks that also have the videos and show you the scanning and the injection technique. In particular, this book is very important because it gives you an in-depth understanding about the knee joint scanning, not just the knee joint, but also anterior, posterior, medial, and lateral scanning, and the intervention for various structures. So it will be a very interesting reference for you if you are interested in the knee region, the scanning, and the procedures. Very simple. If you want to inject into a knee joint, the target is the suprapatellar bursa. The recess here is an extension of the knee joint. So this is a detail of the suprapatellar recess. Just above the patella, this is the quadriceps tendon. In young patient, this is a trilaminar structure. And just above the patella, there is suprapatellar fat pad. And here before the femur, in front of the femur, is a prefemoral fat pad. Between the two fat pads is where the fluid that can bathe in this bursa. Now, if you actually put the ultrasound probe just above the patella, so is patella, is the head, the foot, there's a femur, and you can see right away the trilaminar structure of the quadriceps tendon, and this is suprapatellar fat pad. There's a femur, this fat pad is a prefemoral fat pad. In between these two fat pads is the suprapatellar recess, and this is the target where you want to put your needle in because it connects with the knee joint. Now, the space I just showed you is more physiological. Yes, in between the two fat pads, usually you see some fluid. But when you see the fluid that actually extend even over the the prefemoral fat pad, that means the patient have effusion. The scanning is fairly easy by putting the ultrasound probe over the patella, and you will see this two fat pad and the suprapatellar recess. But you don't want to put the needle directly in plane because you will damage the quadriceps tendon. So you usually want to turn probably 90 degree and sometimes 60 degree and put the needle from the lateral to medial and towards the recess there. Here, one of the picture, you can insert the needle all the way to the recess. Okay, I'm going to show you the zonal anatomy scanning in real time. So one of the important thing is to put the knee slightly bent with a pillow or something to support so that you tense up the quadriceps tendon. And you put the ultrasound probe in the long axis just over the patella, and you will see this classical picture: patella, the quadriceps tendon, suprapatellar fat pad, prefemoral fat pad, and there's a recess there. And once you see this, you may want to focus. If you want to see a little bit more about the quadriceps tendon, you will see a very beautiful trilaminar structure like this here. And this particular easily seen in a young individual, but when you are older, you may have some wear and tear, you may not see these trilaminar structures. So that's roughly what you want to establish, but then once you see this suprapatellar recess, you want to turn 90 degree or at least 60 degree so that you can see the recess, and then you can allow the needle to be put away from the quadriceps tendon. And this is very, very important. All right, so then once you have this position, you're ready to put the needle from lateral to medial in plane. All right. The next one is the injection. Now, once you establish the position, what you have to do is just put the needle in plane from lateral to medial and make sure you go into the recess, the fluid. And once you put the needle there, you just hydrolocate and make sure the fluid is a needle. Make sure the fluid just go into this bursa. You will see in a moment. You see here, so the fluid just go inside the bursa there. This is very important because by far the common mistake when a surgeon perform we call the a blind injection. They inject into the fat pad because it gives you loss of resistance. So it's very important to make sure the fluid go inside the bursa. So I think that's what I want to cover. So thank you very much.